Alright, good afternoon everyone. My name is David Oliva, and today I'll be going over the resurgence of psychiatric use of psychedelic drug therapy. The date of this brief is 23 June 2016. Here's the outline I'll be going over with you today. It'll be the introduction and the historical use of psychedelic therapy, the consequential ban of research into psychedelic therapy, resurgence of investigative research into psychedelics. After that, I'll be going over some of the current events concerning this research and the impacts of health and risk factors of alternative psychiatry, such as psychedelic therapy, controversies concerning this type of therapy route, and lastly, psychedelics and the contemporary health concerning healthcare, from the recent steps and leaps from this type of research. So overall, as you can see right here, there has been research in the past. It has not been a new concept to use psychedelics for therapy and for therapeutic reasons. A German scientist back in the 40s was using LSD in Germany for his patients, but when it comes to the Americas, especially North America and the United States, there was a pioneer under the name of Dr. Timothy Leary, and he's experimented with psilocybin, or magic mushrooms, psychiatry and therapy, in which he noticed with all his patients that he did conduct this experiment with, 88% had a positive impact, in which 62% claimed their lives were changed for the better. And so this right here is just letting you know that the Concord experiment from Dr. Leary in 1961 was an excellent positive impact of using psychedelics for patients. Later on, as you can see right here from his book, here's a picture of it, the hallucinogens. This book was written by Dr. Hoffer, and he used LSD-aided therapy. LSD with the straight name of acid. That's what he used to help patients, and he noticed that not only did it help patients remove blocks in therapy, it also helped them with anxiety, and it helped transcend patients to accelerate therapeutic process. When it comes to therapy, a lot of times there's mental blocks where a lot of time and trust has to be used by the therapist in order to get to the patient to figure out what's wrong with them. But this right here, he said that LSD was an accelerator which helped him tremendously with his patients. So says 1967, Hoffer and Osmond for the book Hallucinogens that they helped publish. So early history, there's been a lot of positive impacts when it comes to research, clinical studies by various researchers in the 60s and 70s. But as President Nixon came online and was elected president, he dubbed something called the War on Drugs. And what that means is he helped pass the Comprehensive Drug Abuse Prevention and Control Act of 1970. What this ultimately did is it banned all research into psychedelics, to include LSD, MDMA, marijuana, and psilocybin. And he used a scheduling system in which to classify the dangerous use of these drugs based on Schedule 1 being the most dangerous, no medical use whatsoever, versus Schedule 4 or 5, which is drugs that can be properly prescribed by a medical doctor for patients. And the war on drugs still continues to this day. So as we go on, we move on further, there's been an illegal substance era, and overall, all medical research into psychedelics has been denied indefinitely, but that has eased up a couple decades after the act was passed. And as of recent years, has been leaps and bounds when it comes to research being able to be conducted again. So this has been a highly debated item. This has been very recent as of years on the resurgence of psychedelic therapy. But overall, doctors still need strict approval from the federal government to conduct research. Overall, the drug research with promising therapeutic effects, as you've seen from the Concord experiment, a lot of these drugs have been redefined as Schedule 1 by the DEA. And what that means is no current medical use for these types of drugs under Schedule 1, high potential for abuse. It can form psychological and physical dependence for patients. And some of this was going to be the most controversial drug is going to be marijuana. as we've seen that marijuana has been scheduled as a Schedule 1 drug, but we have seen astoundingly that many states have passed the legalization of medical marijuana into their states, allowing patients to use it for a number of health reasons, to include glaucoma, mental health, pain, the terminally ill, stage 4 cancer patients. So when you think about this, you think, well, if there's no medical use for marijuana, yet the research has been done, the states who have actually legalized it, you got to sit there and think, is that honestly a valid scheduling of this type of drug? On top of this, we've seen from the earlier slides, LSD and the psilocybin also had positive impacts and helped patients tremendously when it comes to mental maladies with that. But overall, as Schedule 1 is saying that these types of drugs that were used by health professionals in the past with positive results are now illegal and no longer able to be used. But here in the brief, I'll be going over that's soon going to change. But overall, that's from the DEA. That's from Fields, April 6, 2016. From his article, the DEA plans to decide soon whether the U.S. will reschedule marijuana. So we have seen a resurgence of research in these past few years. Very recent. We have seen a resurgence of research. One of these results is from MDMA. This has had excellent results for PTSD patients. And there was a clinical research study done, and I'll be going over it verbatim here. In stage 1, the clinical response was 83.3% in the MDMA group versus the 25% in the placebo group. Overall, 10 of the 12 patients no longer met the DSM-4 criteria for PTSD when used MDMA-aided therapy versus the 25% who just simply had the placebo. So as you can see right here, there actually is evidence showing that MDMA has had an excellent response for patients when it comes to PTSD. And also I want to point out that MDMA is safe when properly administered. Now, with any type of drug, to include over-the-counter medications or even just vitamins, if you will, there is toxicity. You can overdose from anything that you take in excess. So MDMA is indeed safe when properly administered by a health professional, but a lot of these drugs that you see, especially from the DEA, there's been a lot of recreational use since these drugs were made, and this is where they get a lot of bad reputations for being like a party drug, such as ecstasy. You can see the picture on the right. But it's not exactly warranted. When properly used by a health professional in a therapy type environment or even a control experiment, this drug has been excellent for patients who've suffered from PTSD. And that is not just this, it can be also used for a number of therapeutic uses as well. But moving on, we also had a medical marijuana. We already know that different states have actually legalized medical marijuana, but Dr. Mitchellum has began research into medical marijuana in the PTSD therapeutic process and that aspect of it. Unfortunately, there's been nothing but anecdotal evidence supporting marijuana. There's been a VA study, Veterans Affairs study, when it comes to medical marijuana. They didn't find any solid evidence to show that medical marijuana did indeed help PTSD victims, but overall we have seen the patients themselves speak otherwise. And frequent anecdotal evidence and studies show excellent PTSD treatment for medical marijuana. And as you can see right here, back from Dr. Mitchellum himself, 2010, general use of cannabis PTSD symptoms. Even though he says there's been no official or properly conducted experiment that exists today, he has been making leaps and bounds into the positive impact of medical marijuana when it comes to PTSD victims. So current events, as you see right here to the right, is going to be Senator Elizabeth Warren. She has been lobbying for the use of medical marijuana for a lot of different states. She actually submitted a letter, you can see right here from the bottom right, she submitted a letter to the DEA, and that's the DEA's response to her. But overall, there's been past attempts of medical marijuana back in the 90s, and they weren't very fruitful. The DEA still stood firm on the Schedule 1 classification of medical marijuana, but since so many states have now legalized it for medical use, and even some states for recreational use, such as Colorado, the DEA has now been put in a bind as of recent years. So this right here, from a contemporary health issue, medical marijuana, one of many psychedelics that can be used for positive therapeutic uses, has now been very much seen in a positive light. So much that even the President of the United States has also looked into this. You can see right here to the right, this is what President Obama has his view on medical marijuana. But overall, according to Ingram on his article from 2015 on June 22nd, titled "The Obama Administration Just Made Medical Marijuana Research Much Easier," here's some of the highlights from his article. Is that President Obama wanted scientific validity and ethical soundness when it comes to research. So privately funded organizations can now conduct experiments into medical marijuana. And overall, the biggest impact is the Obama administration has made scientific research possible again into marijuana, a psychedelic that has been banned for the past 3 decades. So this has been definitely a radical change when it comes to the ability for health professionals to prescribe psychedelic drugs for patients. So there is some controversy when it comes to psychedelic drugs. And you also got to wonder, well, they've been banned, they must be banned for a reason. So there's a list of drugs from Health the Basics from Donatell, or textbook. We see that many drugs on there that have dependence, psychological and physical. As you can see right here, unfortunately, this patient, and it's the picture on the right, has had physiological effects of using methamphetamines for 10 years. You can see the face has physiologically changed for this patient. So when I say there are bad drugs, I honestly believe that meth, cocaine, narcotics, even though narcotics are prescribed to patients, I believe that some of these drugs are indeed bad for patients. And I honestly do believe that meth and cocaine and some of those other drugs do belong to Schedule 1 classification under the DEA. So when is it okay to prescribe psychedelics? Well, as we've seen lately, that even though these banned substances, which had great positive impacts from the 60s and 70s from those experiments from Dr. Leary and Dr. Hoffer, have now reemerged into a now positive light. The ability of therapists and psychiatrists just having the option of using these drugs once again for patients is excellent. If evidence shows banned substances indeed have more positive medicinal purpose versus SSRIs, which is going to be your antidepressants, would you consider taking them? So there's in this next slide here in a bit, I'll show you the many deaths that we've seen from antidepressants versus medical marijuana and MDMA. And those two types of psychedelics have had excellent results when it comes to depression and PTSD versus the SSRIs, which has had a lot of deaths. So where should you draw the line? Even though right now it's currently seen as the line being drawn as these types of drugs banned, should it be redrawn? And that's where as the critical thinking aspect of this is why have psychedelic drugs have been labeled so negatively for decades, even though the medical use of them is excellent and very much positive. So you can see right here there was a statistic done by the Office of National Statistics in England in which they looked at all the deaths from drugs. And overall, I put a star next to MDMA, which is one of the drugs that was used for PTSD that I honestly believe that has excellent use for PTSD victims. As you can see right here, there's only been 5 deaths. And cannabis, 2. And this is from England, even though the United States had 0 from that particular statistic I showed you earlier. But this one right here is solid, has been done by an actual government agency. So the biggest things I want to point out, the trends and my own personal analysis on this, is that the antidepressants up top, all antidepressants, there have been 157 deaths. Now, MDMA, when it's used for PTSD or depression, or marijuana when used for PTSD or depression, their total deaths equates to 7. So you gotta think to yourself, are psychedelics actually that bad? If they're properly prescribed, just like these antidepressants are, what seems to be the logic here on banning them? Should we actually relook into psychedelic drugs, its therapeutic uses, and actually make that legal? And we have in the United States. This has now become a contemporary health issue in the past few years, is that medical marijuana, federally approved research in MDMA, has actually been possible once again. And what the research has been done just shows the positive light and the success with the use of these drugs has been excellent. So when it comes to contemporary health, here are the new emerging factors that I found personally when it comes to using psychedelic drugs. Politicians, state governments, presidential cabinets such as President Obama himself, the people are pushing for change. They want to have a relook into the medicinal use of these psychedelic drugs that have been banned for decades from the DEA. I hate to say it, but perhaps these drugs are honestly misclassified as Schedule I drugs, especially marijuana. Therapists, psychiatrists, medical researchers are allowed to conduct studies once again. On top of this, I think it's because there's been a lot of pressure on the DEA because 23 states have already legalized medical marijuana despite federal law. And it's interesting because federal law still states that marijuana is illegal, but the federal government says that, excuse me. But the states simply bypassed it now. And alternative psychedelic drug therapy being shown in a positive light, especially PTSD and MDMA aided therapy, and the 83% official study done by the MAPS organization for that has shown excellent response rates. And I'm just curious myself, and also want you to think about, if medical marijuana has already made leaps and bounds, has already been legalized in a lot of different states, where will that leave MDMA and possibly LSD and psilocybin in the next 10 years? I wonder that myself. So overall, there's been new changes. As you can see right here, there's been new organizations who are for change, such as the Multidisciplinary Association for Psychedelic Studies, also known as MAPS. Excuse me, the Asona Institute and the Hefter Research Institute. And I just wanted to directly quote from Denmark in from 2015, the Altering State of Psychedelic Research. Ideally, the skills and knowledge learned in the certificate program will be finalized in advanced training at a psychedelic-assisted psychotherapy researchers affiliated with MAPS and or Hefter Institute. What that means is now postgraduate therapy training certificates can be given to health professionals that actually properly prescribed and controlled studies and experiments for patients when it comes to MDMA, when it comes to marijuana, psilocybin, and LSD. So this right here has been a definitely drastic change that we've seen in the past. So just know that this has definitely been now made possible again, even though these substances have been banned for decades. So the closing remarks I want to leave with you today is, I hope that you saw that the initial use of psychedelic drugs in therapy has been nothing but positive. I've really honestly tried to find a negative experiment done with psychedelic drug therapy. And it's not just for recreational use. Some of these drugs are indeed bad because you can't overdose on them, especially MDMA. We have seen that in the rave party scene, and people have a toxicity when it comes to MDMA and actually overdose on that. Other drugs such as marijuana, you can't honestly overdose on, according to the research that I've done on that. But overall, these drugs that were used in the past in the 60s and 70s with excellent results, or thus consequently banned from the Act of 1970. And then as of these recent years, these very few recent years, we have seen a resurgence of the federal government allowing health professionals and the healthcare entity, if you will, to actually conduct experiments again in controlled environments to see the positives of the use of psychedelic drugs in therapy. And it has been nothing but good things. There's only one report I could find on medical marijuana that was neutral, and that was done by the VA, and it looked into the actual evidence to see that does medical marijuana help reduce the symptoms of depression and PTSD in these patients, and it had results that were neutral. But overall, according to anecdotal evidence, according to Dr. Mechelen, they have been excellent. So overall, the things I want you to get out of this entire briefing is that yes, psychedelic drugs are still indeed illegal. You still cannot have them. They're not for any recreational nor medical purpose. But that, as recent years, has been questioned not only by the health professionals of America, the healthcare industry, also the federal government, even up to the president, senators, the political parties have now been pushing for the research into psychedelic drugs. And it's many positive impacts, not just for therapy, but also for the terminally ill cancer patients and for those who are in chronic pain. So overall, this concludes my briefing. I hope you learned something from it today. And go Lancers!